Hello everyone, I am Marvin Roy Lapasa, third-year medical student from the University of Cebu School of Medicine. And today I will be demonstrating how to perform your simple interrupted suturing technique. It is actually one of the most commonly used suturing techniques. It is called interrupted because individual stitches are not connected with each other. This means that if one stitch fails, the other stitches can still hold the wound in place. So here are the materials that we will be needing. Of course, we need our dummy skin, then our materials. We have our Mayo scissors, our tissue forceps, and our needle holder. And lastly, we have our suture. Let us now set up our suture. Load the needle into the needle holder between the apex of its curvature and 2/3 from the needle tip. Then straighten out the suture. So our pattern will be out to in to out. So let's take this one right here. So let's begin. The first part will be from out to in. Gently lift the skin using the forceps, then pierce the surface with the needle perpendicular to the skin. Lifting with forceps allows good visualization of underlying skin layers and allows you to plan your needle exit. This will help prevent burying the needle too deep into the skin layers. Supinate your wrist so that the needle passes through the dermis and rises out to the middle of the wound. Re-grasp the needle and lift it out of the wound. Use forceps to hold the needle while you reload your needle holder. The next part will now be from inside the wound to outside, in to out. So using the tissue forceps again, lift opposing skin edge, use curvature of needle and supinate your wrist to move the needle through the skin. There should be equal needle bites of depth and distance from the wound edge. Let's now tie our suture. Loop the suture away from you around the needle holder twice. Grasp suture end with your needle holder. Then pull needle holder towards you and push your non-dominant hand away to lay the first knot. Now loop the suture back towards you around the needle holder once. Then again grasp suture end with the needle holder. This time, push the needle holder away from you and bring your non-dominant hand towards you to lay the second knot. Lastly, loop suture away from you around the needle holder, this time only once. Then grasp the suture end. Then pull needle holder towards you and push non-dominant hand away to lay the final knot. Pull knot to one side so it's not overlying the wound. Hold both ends of suture and trim to about 1 to 2 centimeters. Make sure not to cut it too short because it might make suture removal difficult later. Repeat process until the wound closure is achieved. And we have now finished our suture.